Alrighty, so welcome to part number two. This presentation is all about ergonomics for the dental professional, and I can guarantee you've probably had at least one lecture about ergonomics in your education. But I think that this will serve one as like a really nice reminder now that you've been in practice and you have been assisting, and maybe you have been putting yourselves into positions that might not be the best for you, but really great for the practitioner that's providing the care. So either your dentist or your hygienist or the after, whoever is providing the care, you might be kind of stretching and leaning and trying to help them have really good visualization. So this might just be a nice refresher that you need to take care of you and yourself, and just be mindful of the way that you're working. And then also now you are going to be maybe not for the first time being the provider of the care to the patient, but maybe more often now that you're going to be a corona polisher. And so we'll talk about like the specific work zones that are good for you as an operator and all of the other things that come along with ergonomics. So we'll go ahead and get started here. All right, so ergonomics definition, ergo means work, and nomos is like the natural law. So it's the study of humans and their relationships to their work environment. And so we want to do whatever we can to have like a harmonious working relationship between our body and our environment. The goals for proper ergonomics are to optimize worker performance using the products and procedures so that they can work more effectively, and then to create a safe and healthy work environment. And so we'll talk about all of the pieces and parts that make up a really good posture and proper positioning. So cumulative trauma disorders, or CTDs, have lots of different names that you may have heard it referred to as. So repetitive motion disorders, I'd say probably the biggest one that I've heard is work-related musculoskeletal disorders. So anything where you're doing like repetitive motions and it's causing you some kind of pain or trauma or something related to the work that you're doing. So it could be caused from prolonged, repetitive, forceful exertions, awkward body movements or positions, or not only physical stressors, but also psychological stresses. And so I'm sure that all of you have been like emotionally stressed or, had stress in your life, and you can feel it physically in your body. And so, we want to, be mindful that it's not only what we're doing to our bodies physically, but also mentally. Okay, so this can affect your muscles, tendons, ligaments, your bones, your joints. All of those things are pretty common and what we might recognize and feel the pain, but it also can affect like blood vessels and nerves, and that might not necessarily be something that you can feel or that you pay attention to, but it definitely is affecting that part of your body as well. So, musculoskeletal diseases are the #1 workplace injury in the US, and specifically for dentistry, it's the #1 reason for early retirement. So, we have lots of neck and back issues, and then also hands and wrists. So, it's really, really important to be paying attention to this. So my colleague who does this for the presentation for the dental hygiene students, she likes to share this comic, and it's just kind of silly. But the guy goes to his boss and he's like, "Oh, I'm in so much pain." And the boss is like, "Didn't you know that work is supposed to be painful?" And the guy's like, "Well, I can't feel my hands." He's like, "Well, my whole body's numb." So you hopefully don't work for an employer that isn't supportive of you and willing to listen to you. Hopefully you work for somebody that is supportive and is willing to help you, whether that's giving you extra time to complete your tasks if you need it, or getting you different equipment that might be beneficial to your working environment. And we'll talk through some of that too as we go along. So signs and symptoms. So signs are things that you can, or the patient can see, and symptoms are things that you can feel. So stiffness and cramping, or muscle or nerve pain, numbness, tingling, or worst case scenario, burning sensations. As you can probably imagine, disc problems, neck problems, and loss of muscle function, and worst case scenario, probably besides that, like burning sensation, would be deformity. Carpal tunnel is something that I was really afraid of when I was in hygiene school. We hear about how terrible it can be, and how like a career ending it can be. And so carpal tunnel is like compression of the medial nerve that's here in your wrist. And the it can happen due to like swelling. It can cause pain, paralysis, tingling in your fingers and in your hand. Again, like that burning sensation. Oftentimes it gets worse at nighttime because you have been working and utilizing it all day long. You can also experience this. Women can experience this during pregnancy, and oftentimes it kind of subsides after the baby is delivered, which is great, but not always. And the surgery for this, they go in and they cut through this portion of your wrist. And it's not a very easy surgery, or an easy surgery to like recover from. So not something that we would choose to do. We would probably prefer to prevent it if at all possible. So this is not something I would ever expect you to memorize, but this is just a visualization so that you can see like the natural contours and curvatures of our spine, so that you can anticipate like what normal is. And so then we can hopefully try to help to facilitate sitting in a position or standing in positions that would promote these types of curvatures. So, starting at the base of your skull, the cervical portion of your spine kind of curves forward, and then the thoracic part curves backwards, and then lumbar is back forward, and then the sacral is kind of coming back towards the front part of your body there. Some risk factors that can lead to, improper ergonomics and eventually back pain include increased body mass. So if you have more weight to carry, that's going to be a lot harder on your bones and in your joints. And so you're going to feel that more. Poor posture, like this gentleman here who's leaning forward to try and get better visualization, and or poor patient positioning. And so this patient in particular is probably sitting up a little bit high, and I have better pictures as we go along here, but this patient's probably sitting up a little bit too high, which is resulting in his arms being like above his hands being above his elbow. He might lose some circulation in his hands. So that is not setting him up for success. And then as you make one minor adjustment to your back off of the natural posture, then it leads to another position that might be off, and then another, and it just compounds with each little change in the curvature of your back, and that can really lead to lots of long-term back problems, including like migrated discs, or herniated or bulging discs, and that is not something that anybody, I'm sure, wants to deal with. Additionally, we have some risk factors that might hinder our neck and our shoulder, or promote neck and shoulder pain. And so this wouldn't only be things that we do at work, although there are plenty of things that, when we're working in the dental profession where we're having our neck tilted or our head tilted forward, causing that neck flexion for static or prolonged time. But also, just like this picture is depicting, looking down at our phones all of the time. And so I always think about this after I had my daughter, who is now 8, shortly after I had her, like maybe a few weeks or so, I like stopped being able to like look up. So I'm going to turn to the side so you can see. I, was constantly like looking down at her and like looking down at my phone because I was on maternity leave. I didn't have anything else to do. Like constantly like looking down like this. And all of a sudden, this is about as far as I could like lift my head up. I couldn't go like this. I couldn't look back. It was literally like this, and that was it. And so, I was constantly looking down and I had, hurt my neck. So I had to go to the chiropractor and they were able to do adjust, put in a schedule of adjustments. And thankfully it's back to normal. But um, I will say too, like going to the chiropractor is fine, but if you ever decide you feel like you need to stop going to the chiropractor, like if you don't need it, or whatever, it's kind of like you're breaking up with your long-term boyfriend or something. It's really hard to stop going because they always just like go ahead and put the next appointment in and the next appointment in. So if you don't have to go, let's try to prevent it so you don't have to have a breakup. But in addition to that, other things that can kind of affect your neck and shoulders include like your shoulder position. So if you are constantly having your shoulders like this, like sometimes I'll just look over at my husband and he'll be like standing like this. I'm like, calm down, relax your shoulders, because that really is putting a lot of stress having to hold them up like that. So just be mindful of that. And we'll talk about too how your arms should be positioned, which will help promote relaxing your shoulders. So some risk factors for your arms, hands, and fingers include like repetitive motions, like small little fine-tuned motions over and over and over again, which we always do in the dental field. Using vibrating equipment, which includes handpieces that we're going to be using for coronal polishing, or other dental professionals, the handpieces, or even like making temporary crowns, the ultrasonic scaler for hygienists, plenty of things that are vibrating that can cause problems with your hands and fingers. Like repetitive, like pinching motions. And so for hygienists, we're constantly like squeezing that instrument and making that pinching motion. As an assistant, you might be kind of pinching to grab and pass instruments from one provider to another. With that coronal polishing, you might kind of pinch to kind of twist that handpiece around. So try to avoid doing that if you can, because that pinching motion really can put a strain on your hands. And then again, like those static movement or static positions where you're in the same position for an extended period of time. So in order to prevent these from occurring, it's really nice if we can take periodic breaks. And so I think that, sometimes we can get away with this in dentistry because, oh, got to go get the doctor, got to get up and go and do this, got to get up and go and do that. So if you can kind of work that into your schedule, find a good excuse to get up and go and leave the operatory, that might help. I really enjoyed working on like the EFTA side of things, because I felt like we were just like busier back there, like doing all of the things. And I'm sure you guys know, feel that being an assistant. We were just like always busy doing a whole bunch of things instead of like sitting with your one patient, like kind of focusing on that. And so kind of working in the back of the office is what we called it. I found that we were able to alternate our tasks a lot more. And so that might kind of naturally work into your work schedule potentially. And then definitely exercising and stretching can help to promote or like kind of combat some of those poor decisions that we might be making when we're working on patients. And so we're going to kind of go through a little stretching routine here in just a minute, but definitely something to consider. And then just how I was talking about like emotional stressors, trying to kind of relax and get your mind right. Deep breathing or yoga might be a good way to kind of just like reset your mind and get rid of some of those emotional stressors. And so I have to get out of my screen here to open up her little video, but this is Jessica and she's a dental hygienist and she has these little stretches that I think are great. So as she goes along, I want you to do them with me and with Jessica.
So, this may be news to you, but we work a lot with our arms and our back and our arms and our arms. And you may feel that you're getting pain or numbness or tightness in your arms. So I'm just going to show you just a few stretches for your hands and your arms. So the first one we're going to do is a wrist flexor and extensor stretch. So you'll do is you'll put your elbow out straight and you'll bring your hand back, and with the opposite arm, you're gonna help your hand come back as far as it can go. Now, a tip for this is that you want to push on your palm, not just your fingers. So this is just your fingers, but you want to actually push on your palm and you get a better stretch. I have to remind myself to keep my elbows straight. And then the opposite, you're gonna move your hand down, and with the opposite hand, you're gonna push those fingers, that palm towards you. Make sure you do the stretch on both sides of your body. Hold the stretch for about 8 seconds and repeat this one 2 times. It's important for us to do this daily, daily, and I can feel this really good. Actually, maybe I should do it more often. And the next one is a thumb stretch. You're gonna put your hand straight down and you'll use your opposite hand to pull your thumb towards your head. And you're gonna hold that for 8 seconds and repeat it 2 times. Make sure you do it on the opposite side. And then you can do individual finger flexor and extensor stretches. You're gonna, with the opposite hand, you're gonna bring each finger up, hold it for 8 seconds, and do 2 sets of that and down for each finger. Up and down. Sometimes you'll get a little pop. Up and down. Make sure you do it on both hands, all 10 fingers. Well, 8. Similar to the flexor and extensor, this time it's going to be, your hand's going to be in a fist. Straighten your elbow, bring your fist down, and with the opposite hand, pull it back. And I feel this all the way up. Okay, make sure you do it with both hands. This exercise increases the circulation in your hands. So you literally just stretch your hands out like this, and then close them up really tight, and then out like this, 5 seconds, and then close them tight for 5 seconds, and out again. And you can do that 5 times, and that will increase the circulation in your hands. Another stretch that I really love is you take your hand, you take your thumb, you tuck it in, you give that thumb a hug, straighten your elbow, and then just point that thumb down. That stretches all up through here as well. Remember to do it on the opposite side as well. Let's protect these hands. Those are your money makers.
I think she's really charismatic. I think she's cute. And a couple of those stretches, I was like, oh, I can feel that. You probably see my face when
This
I was
video
going
was
through that.
sponsored by Ken Hub.
There we go. Okay. And we're back. So hopefully that kind of stretched you out a little bit. Felt like I was doing jazz hands, you know. All right, so let's talk about, continue talking about how we can prevent these musculoskeletal diseases from occurring. So we'll talk about your patient position. And so we really want our patient in the supine position, and we'll talk about when that might be modified a little bit as we go along the presentation. But by supine, I mean that you really want that patient laying horizontal, head in the headrest, which especially for those pedo patients, that's sometimes a little bit challenging. You gotta like grab a hold of it and pull them all the way up. And their heels should be higher than their nose. The ideal distance from you looking down at your patient, so like the space between your heads would be like a foot, foot and a half, so 12 to 18 inches. And when you're sitting there next to your patient, your elbow should be like in line with their occlusal plane. And so that's kind of telling you how high you want the base of the chair to be. So you don't want it so high to where your elbows have to be up like, or your shoulders have to be up like this, so your elbows in line. You want your shoulders relaxed, elbows at the position of their occlusal plane. The goal here is that we're really trying to get our body in that neutral position all throughout the day. And so if you can imagine, anytime you've seen like those science depictions of like the human body, and they're just like standing, I know you can't see my whole body, but they're just like standing there. When you see that, palms are usually like facing forward, the shoulders are relaxed, the arms are like lightly next to their body. Just everything looks really relaxed. The spine is nice and in line. You're trying to stand there without any of your muscles having to contract, just very neutral. And so, I know and I understand that that is not necessarily possible all day, every day, but that's the goal, to try and be in that position as much as possible. So, when we're talking about a neutral, like chair, like sitting position, you really want both of your feet flat on the floor. So I know obviously when we're assisting, a lot of times our feet are like up on the little rungs at the bottom of the chair, but that's not what we want when we're the providers. And you want to try to avoid like cramming your legs underneath the patient's chair because A, that's not super comfortable. And B, your patient's, the base of the chair is probably going to be too high at that point, and your shoulders are going to have to be raised in order to get your hands up into a working zone that's comfortable. So instead, if you're sitting at like the 12 o'clock position, for example, you're going to have your legs kind of spread on either side of the headrest. So you're kind of in that tripod position. Also in these pictures, hopefully you can see that the neck is nice and straight, resting over the spine, not leaning forward. It's really supported by the entire body. And the center of your body is in the center of the stool with the backrest supporting your back. So one of the alternate options that might help improve your ergonomics as far as like a product that you could purchase and use is a saddle chair, which I'm sure you guys have probably seen these. Maybe some people have them in your offices, but it's depicted here in this picture. And so some saddle chairs have like a little, like an arm bar or something on it as well, but some of them are just like this, where it's literally just the seat. And so you can see when that provider is sitting there that their back is nice and straight. They don't have something to rest their back on, but they're sitting nicely aligned on that saddle stool. You also want to adjust the chair to make sure that your hip is at like a 90-degree angle and your thighs are parallel with the floor. Or as in that saddle chair seat, you can see that the knees are actually lower than the hips, and that's an appropriate seating position as well. You just would not want your knees to be higher than your hips, because then you're going to lose that circulation in the lower portion of your legs. As far as your shoulders, we've already kind of talked about that, but making sure that your shoulders are nice and relaxed. Your elbows should rest just gently next to your sides. You don't need to like squeeze them into your sides or anything like that, but they should just be nice and relaxed. You also don't want them like way up in the sky like little chicken wings. Okay, that's not what we're going for here. Your hand should be in a nice neutral handshake position. So just imagine you're like going to go in and shake your patient's face with a handshake. That's kind of the position that you're going for. Your forearm should be parallel to the ground. Your hands should not be above your elbows, because again, you're going to lose that circulation in your hands, which can cause all kinds of problems. In this picture in particular, she's really putting herself in a really bad position, because not only is she like leaning and bending, but it also looks like she's kind of twisting. And that like compounds the amount of force that you're putting on your body when you're doing multiple things incorrectly. And so it's really important that when you bend from the hips and like move straight forward. And that you don't like bend and twist ever, because again, that's not very good for you. And you really just want to make sure that you are adjusting yourself and the patient to remain as neutral as possible. So instead of being in a position like she is, she could probably scooch herself a little bit closer to the chair and then have her patient turn towards her so that she doesn't have to stretch as far over in order to be able to see down inside of his mouth. What's wrong with this picture? Well, there's a lot. There's a lot just with infection control stuff, right? Like that doesn't look like how we practice anymore. But besides that, as far as her positioning goes, hopefully you can appreciate that her neck looks awfully painful, right? That's like almost a 90-degree angle from her back to her neck. And then also her hands are much higher than her elbows. So she's probably going to need to kind of shake her hands out a little bit just to kind of get some blood flow back to those pretty soon. And then you can't really see it, but hopefully you can appreciate like her right arm that's kind of away from us, that's being blocked by her head, is probably like way up in the sky like a little chicken wing as she's trying to work. That's what it looks like to me. And then what about him? This also looks pretty painful. That's like, again, almost like 90-degree angle between back and head. His back is also really curved and leaning forward. His arms look a little like his forearms look a little bit more parallel, which is great, but they are kind of like out away from his body a little bit more. And he is starting to impede in his patient's personal space. So I've definitely seen worse, but you want to try and make sure that we're giving our patients that foot to 18 inches, which is going to help our positioning. Now, when you're working on the mandibular arch, you can adjust your patient to be not quite in that supine position. And so when we're working on the mandibular arch, sometimes we need to have our patients like lower their chin to their chest. Of course, have them turn their heads as needed. And then the back of the chair, you can maybe sit up a little bit so they're inclined just a little. And then the overhead light really should be directly over the patient's head and coming straight down onto the mandibular arch. We want it coming directly into the mouth. That light should be easily reached by you and not so far or so close to you that you're gonna like bonk your head. But you also don't want to have to stretch for it and reach for it because again, we want to be as neutral as possible as often as possible. For the maxillary arch, things look a little bit different. You definitely want that patient all the way in that supine position, and you want them to tilt their chin up. And in fact, I usually like try and tell my patients, like, look behind you almost so that they're really looking up. Again, have your patient turn their head left and right as needed, but the light is going to be in a different position. You're going to scooch the light over the patient's chest and then tilt it like up to where that beam of light is heading towards the maxillary arch. Um, as far as the operator goes, we like to talk about clock positions. So like on an analog clock, the top of the patient's head is noon, and then we just kind of work our way around their body until we get back up to the head of the position. And so appropriate like working zones are from like 12 o'clock to 4 to 5 o'clock really, and like 7 o'clock all the way back up to 12, depending on if you're right-handed or left-handed. So for right-handed operators, when you're working on the maxillary arch, your first seating position to work on those right buccals is going to be like at the 9 o'clock position. So that is option number 2 down here in this depiction at the bottom. So you can see that the provider's legs are going directly underneath the patient's head and having the patient look towards them, and then they're going to be working on the maxillary buccal. I'd say sometimes it's more like better to have your patient looking straight forward, but then the rest of the maxillary arch is going to probably be closer to this like 11 or maybe even 12 o'clock position where you're sitting directly behind the patient, and your legs are going to be kind of like that tripod position. Um, Oh, I got ahead of myself. No, we're good. So here's that 12 o'clock position. So the other one was more like that 10, 11. This is more like that 12 o'clock position. For right-handed operators on the mandibular arch, again, we like to kind of use that 7 o'clock to 12 o'clock position. So after I've completed the maxillary, my next area that I go to is my lower left buccals. And for that, I'm going to be still sitting up at like the 11 o'clock-ish position. But then once I go to like the rest of the mandibular arch, I usually drop down more into like this 7 o'clock position, how this person is sitting. So my right hip is pushed up against the patient and my knees are angling up towards their head, and then oftentimes have the patient look towards you will help. For left-handed operators, it's very similar, just the opposite side of the patient. And so for maxillary left buccals, you want to be at the 3 o'clock position. And again, with the knees facing directly towards the patient, underneath their head. And then for the rest of the maxillary, you're going to be more at that 12 o'clock position, maybe 1 o'clock. And then for mandibular, for the lower right, you might be still sitting up at the 11 o'clock, but then for the rest of the mandibular, probably going to be at this like 4 or 5 o'clock with your left hip pushed up against the patient and your knees, again, angling towards their head. One other thing to like prevent hand, wrist, and finger issues is to think of your entire hand and arm as one unit. So when I'm working, I want my whole arm to move together. I don't want just my wrist to move up, down, side to side, nothing like that. I want the whole thing to be in a nice straight position and to be working as one unit. So that will be a way to help you maintain like a neutral wrist position and not have those flexion and extension motions that are dangerous and will prevent problems. So in these rather old pictures, you can see the wrist position is nice and straight and neutral. So in these two pictures on the left, this looks great. This picture on the right, not so great. So you can see that bend in the wrist, and that is not going to allow for as much blood circulation into those hands. So you just got to be careful for that. Specifically for your fingers, again, I kind of talked about trying to avoid like those pinching motions. So we just really, really want to try and keep our fingers like soft and light, have a light grasp. We want to avoid like collapsing our thumb is what we call it, where your thumb kind of like bends backwards. You want to limit digital motion. So what that means is like this, instead of moving my fingers like this, I want to move my whole hand and my whole wrist together as a unit. Really finding a stable fulcrum, ideally on the arch in which you're working on, will help you to be most effective. And also it'll be safer for the patient if it's on the same arch. And then, like I said already, I've been avoiding those pinching motions. So for visibility, it's really important that you have a nice set of safety glasses that are clean and lightweight and easy to use. They're not going to like weigh your head down. That is minimum requirement, right? I would like to encourage if you find it in your budget or if your office is willing to provide you some assistance with getting magnification, then those are really great to help you help promote proper ergonomics and also prevent some other things. So here, the kind of like benefit of getting magnification includes it definitely facilitates better ergonomics, of course, because you don't have to lean in order to be able to see better. It decreases the fatigue in your eyes specifically. So if you don't have magnification and you're trying to see, you might be squinting and straining your eyes. And so this just kind of helps to prevent that. And then you have a better, clearer, crisper view of what's going on orally so that you can potentially treat your patients better. In addition to just the loops, the coaxial headlight is honestly like that's my thing that I'm like, oh, I just can't live without my light. It makes all the difference in the world. Sometimes our overhead lights just aren't the best. I don't know about your office. Hopefully they are great, but I've worked in offices or at the college where the lights just don't really have a lot of power. And so the headlamps are really nice for that. Additionally, what's great is they just like follow along with wherever you're looking. And so I don't have to kind of fumble around with the overhead light or move my hand out of the way to prevent the shadowing of the light from my hand. Because if I can see with my loops, then I know my light's going right where I need it to go. So that's really nice. And we just need as much light down in that dark cave as possible because it's really hard to see. I always like when this picture pops up because this is actually two of my classmates from when I was a student. And so it's just nice to like get a little visual of her every time that this pops up in the presentation. Another thing you might not necessarily think about for ergonomics is are your gloves. And so most offices purchase ambidextrous gloves because there's going to be times when you only take off your right hand or your right glove. So if you're always only taking off your right glove, you're going to go through those right handed gloves more quickly. And so that's just like kind of strange. Then how do you know how many to order and like all of that? So although hand specific gloves are recommended because they usually fit better, and they put like less strain on your hand, it's not always feasible or like financially smart for offices to do that. And so you just want to make sure that you have a glove that is lightweight and is not putting strain specifically like across your palm here. So if it looks tight, then you need to go up a size. And so we always have students that are like, I need a medium, like something between a small and a medium, because they just don't quite fit in one or the other. But if you have to err on the side of one way or the other, then definitely err on the side of getting a larger glove that's going to not cause any kind of strain on your hand. So the next thing is just making sure that you have really nice fitting, clothing. You want it to be loose, you want it to be lightweight, and obviously really easy to clean. Not that that has anything to do with ergonomics, but it's important. And then if you are starting to notice some pain or something's going on, there are definitely treatments that you can do. So first is fixing your problem. So whatever's causing the issue, try to make a modification in order to prevent that from getting worse. You can also provide some extra support. So like splinting it, as you can see in this picture, might just help you have a little bit of support and also like provide some corrective action too. That splint probably isn't going to let that person flex their wrist quite as much as they might try to. And so that might be kind of helpful. Um, of course, you can take, whatever you normally take for a headache just to kind of decrease the inflammation and reduce the pain, definitely. Physical or occupational therapy is kind of one of those higher levels of treatment because there's a cost associated with it. You have to make appointments, but that's way better than having to have surgery. So surgery is like your last line of defense. There's nothing you can do to fix it, and you just have to kind of bite the bullet and do it at that point. Um, so here's just a couple more pictures that you can take a look at and see, what do you think about their positioning? What do you think should be corrected? Definitely the patient on, or I'm sorry, the provider on the right could stand to move his head up. It's his head and neck is definitely not being supported by his back. And so all of the weight of his head is pulling down on his neck, and that is not good for his body. He does have a little bit of a chicken wing arm here. His patient's probably is not in the supine position, and so he could probably lower the back of the patient's chair a little bit in order to help with relaxing his arms and getting his elbows down. And then this person, I can understand, she probably can't see. She doesn't have loops. Who knows about the light situation, because as I said, sometimes in the clinic, our clinics are way nicer than they are now, in this picture, but sometimes the lights weren't so great. But she is like in her patient's face. Like, I don't think that she could get any closer. They're probably smelling each other's breath at that point. So she definitely needs to lower her patient's chair. She definitely needs to get her forearms more parallel with the ground, needs to straighten her neck up to where she is not leaning her head forward. So lots of things. One thing I just remembered is that for loops, I don't know if anybody in your office has looked into them, but those ergo loops, those look really cool. If I was in the market for a new pair of loops, I would consider those. But they're also like really weird as an instructor watching people. You look straight ahead, and then the loops themselves like reflect or like bend the view. And so you yourself look straight ahead, so your head can be in a neutral position, but you're still able to see your patient below you. So that's pretty crazy. So if you are in the market for a new pair of loops, I would consider looking into those ergo loops. I'm sure they're offered by different vendors, but yeah, those seem pretty cool. So All right, that is it for lecture number 2. So I will see you at lecture number 3 in just a few minutes, or whenever it is that you feel like watching me. Thank you.